My name's Cameron Marr. I'm one of the new advanced physiotherapy practitioners working in primary care. Our role within primary care now is to assess, diagnose and plan the treatment and management of patients with musculoskeletal conditions. What is musculoskeletal conditions? Well, they are your standard soft tissue sprains and strains that may affect ligaments, tendons, muscles. It could also be bone and joint problems such as osteoarthritis. So what do? Well, we work within the GP practices themselves alongside the GPs and the other members of the new multidisciplinary team. Our appointments are generally about 20 minutes long, and these can be either virtual, so on the phone, or on the video near me system, but more and more now returning to face-to-face consultations. We can come up with a physiotherapy treatment plan, which commonly involves education, advice, and possibly some exercises on how to manage their condition themselves. So when needed, we can refer for diagnostics, the same as a GP. We can do onward referrals to secondary care services, such as our colleagues in the musculoskeletal physiotherapy departments, and our other AHP colleagues, most commonly podiatry and orthotics. We can also refer onwards to the orthopaedic outpatient services and rheumatology, and can refer to the REACH team, that's the reablement teams that work within patients' homes. A certain number of the physios are trained as injection therapists, and a few now are trained as independent prescribers, allowing them to prescribe medication for patients. What are the common conditions that we hear about or see within practices? Well, I think the most common would be patients with spinal pain, so those patients with low back pain or neck pain. We see patients with shoulder pain. Common conditions would include frozen shoulder or rotator cuff problems, elbow problems such as tennis and golfer's elbow, hand and finger symptoms, the common conditions such as carpal tunnel syndrome and trigger finger. We also see hip and knee injuries, the most common of which is probably osteoarthritis. Also foot and ankle problems, the usual ankle sprains and strains, but other conditions such as plantar fasciitis. Sometimes patients can't be that specific, so they may just mention they've got joint problems related to arthritis or osteoarthritis, or they may have had orthopaedic surgery and they're now needing some physiotherapy input post-surgery. These patients are all appropriate for the APP within the practice to see. Well, most importantly, the patients are seen by the right person, in the right place, at the right time, first time.